Oh, we actually have 5 more minutes. Okay, I did not need to rush that much. Sorry, Nebusha joined us little bit after all of us, so I just wanted to go through one more round of introductions. So Nebusha is our colleague from Belgrade, and he's a vice president of the World Academy of Arts and Science. He is the organizer of this series of talks, and he will actually start with an introduction, give a brief introduction to this series of talks. Nebusha, do you want to say, Deborah, Daniel, Sally, Charlotte, all of our panelists are here.
Well, I'll be very short, just to connect this webinar to the other events within the program going on and initiated by the World Academy and going on. But you'll hear about that in a minute or two.
Okay.
Well, 3 more minutes, I think.
Okay, we can wait that long. And Charlotte, I will do that again officially when I'm announcing speakers, but I also wanted to use this opportunity and to say big congratulations.
Thank you. Although we probably can't announce it publicly yet because the university hasn't yet approved it. So soon, hopefully.
I'm glad that I mentioned that.
Yeah, okay. That's okay.
But, so unofficially, whispering among us, as of yesterday, Charlotte is a tenured full professor. So.
Thank you.
Congratulations,
it's exciting.
Charlotte.
Okay. I think that the schedule we wanted to go with was to start with climate GPT and to talk about that a little bit. Then we will go with Sally and talk about AI and medicine. Then we will go and talk about AI and social sciences, Deborah. And we will finish with that charming topic of AI and law, which is, so present in everything, and I would say still so unregulated in a way, or unclear.
Very much so.
It was slightly published different sequence, so I probably need a few seconds to set things up. I'm not sure if if you want to see something live, I'm happy to do that, but it probably perhaps not go first.
Oh, okay. So do you want, we can reverse it. Sally, would you be ready to go first?
I'm as ready as I'll ever be. So it wasn't like I was planning to, I don't know, do something in the extra 5 minutes. So no, I'm absolutely fine.
Okay, great. So Daniel, would that work if we start with Sally and...
Perfect. I just got to get a couple of questions set up so I can show something.
Okay. That's great. Just... Nebusha, will you mention to the audience that we are recording the session, or do you want me to do that? Because I think we should just...
You can do that. I'll also, okay. Just, yeah, you may say that.
Okay.
There are examples on the website, but just let me say something to all of you, the participants. The speakers, we have an obligation to prepare a report on that and to put it on the website in a similar way as it has been done. But I'll let you know about the scheme and what should be included in that let's not lose time right now, but you have all the material, but it will be a bit different from the present contents on the website, but you'll hear about that when we finish today's meeting.
Okay. Sounds good. Thank you. Oh, and it's the time actually.
Okay. Let me tell you, you are the chief. When to start?
Nebisha, I believe that we are already 1 minute into our session, so I believe that we can officially start.
Okay, thank you very much. Hello, everybody. Let me open this webinar, this WAAS Talks on Science for Human Security. As some of you know, in August 2023, the UN General Assembly proclaimed the International Decade of Sciences for Sustainable Development. It started this year and it will last until 2033. The task to lead the preparation and implementation of all the activities within the decade was given by the General Assembly to UNESCO. Connected to that, in April this year, the Earth Humanity Coalition was founded but it is a new association of global, regional, and national scientific organizations with the task to prepare and implement in close cooperation with UNESCO various initiatives within the overall program of the decade. The World Academy of Art and Science was among the founding members of the coalition. It had initiated the Academy, the WAAS Program of Sciences for Sustainable Development, which became, with the forming of the coalition, a specific initiative of the coalition. The WAAS Talks on Science for Human Security, this one focused on artificial intelligence, is the fourth webinar within the program. The reports on the previous webinars can be found on the WAAS website, and I suggest to all of you to go there and to go through to find interesting contributions. The page is events, I guess it'll be easy to find that. Okay, that has been the opening. Smiljana, please go on as the moderator. Thank you.
Thank you so much, Nebisha. Good afternoon, everyone, and thank you, Nebisha, for your thoughtful opening remarks. Our panel today, as Nebisha said, is part of the ongoing series of talks addressing human security and some of the key challenges of our time. Today's discussion is particularly important as we explore the evolving relationship between artificial intelligence and human security. AI technologies, as I'm sure you have heard and read many times, hold big potential for improving quality of life, but they also present complex challenges which are impacting every aspect of society, such as climate change, inequality, public health, and so on. The United Nations, as Nebisha mentioned, has declared the current decade as the International Decade of Sciences and Sustainable Development, exactly to reflect on the urgency of addressing such global challenges. Artificial intelligence is, we could say, at the forefront of these discussions for the ways in which it could either safeguard or undermine human security linked to these critical issues. So as we dive into our panel today, we will explore the intersection of artificial intelligence with medicine, climate change, social sciences, and law. We are joined by 4 distinguished speakers who will each bring their expert perspectives to these diverse yet interconnected fields. We will first hear short statements from each of our panelists, and after that we will transition to a discussion among the panelists, which will lead us to a conversation with all of you in the audience. If you have any questions or comments during this first part of the panel discussion, please submit them via the chat function. And I just want to mention that this session, like all sessions of the World Academy, is being recorded. So I'm now honored to introduce our panelists. First, we will hear from Sally Wyatt, who is a professor at Maastricht University and who will look at AI's transformative role in medicine. After that, Daniel Erasmus, who is the founder of Erasmus AI, will explore the intersection of AI and climate change. Deborah Lanzani, a researcher at Monash University, who will discuss AI's implications for the social sciences, and Charlotte Scheider, who is a professor of law at Loyola University Chicago, and who will examine the legal and ethical dimensions of artificial intelligence. So to begin our panel, I would like to invite Sally Wyatt, who, as I mentioned, will discuss the ways in which AI is transforming the field of medicine. Sally, the floor is yours.
Thank you very much. I hope the admin people can show my slides so you can all see them. I'll just wait for a moment. Oh, that looks promising. Right. Well, thank you very much. It's a great pleasure to be here. And I drew the long straw, and I've got the wonderful time slot of, 1:30 in the afternoon. So I'm fine. But thank you to everyone else who's participating in less friendly times from slots. I'm going to talk a little bit. I just have 5 minutes or so just to kind of kick off the discussion and want to raise some issues about kind of AI in medicine and healthcare more broadly. I've been doing work about kind of the use of digital technologies in healthcare for about 25 years now. In the beginning, around the internet as a source of health information. I've also done some work on direct-to-consumer genetic testing, things like companies like 23andMe that you may have heard of. And now, and I'll say a little bit more about that in a moment, I'm doing some work about the use of AI in image-based clinical decision-making. It's basically pathology and radiology. So could I have the next slide, please? Just one of the things I want to kind of highlight is that, over these last 25 years, you see recurring claims, that many of the same sorts of claims are made about, the use of the internet to find health information by patients, the possibilities to get your genetic test online, and all sorts of other things. And that, this is true of digital technologies and new technologies more broadly. But I won't go through them in any great detail here, but the idea that they're all always new and exciting and innovative. They're going to change relationships between patients and healthcare professionals for the better. Patients will become empowered. It won't matter where you are in order to access good quality health information and healthcare. It will improve efficiency and reduce costs. And I think perhaps most importantly for today, that data and the algorithms to process the data are increasingly the basis for medicine and healthcare. Of the next slide. Thank you. So this is actually from our website, and you can see the link up at the top if you should want to pursue it any further for the project I just mentioned about AI and clinical decision-making, particularly image-based. I'm doing this together with Flora Leeson, also at Maastricht University, and Karen Jongsma, Megan Malotta, and Joanneke Drocht at the University Hospital in Utrecht. And we're actually almost at the end of this project. So, you can, if you go to the website and click on some of those things, you might actually find something. Possibly not the film. The film is more or less ready, but probably won't be made available on the website until the end of the year. So I will talk a little bit about the film in a moment. For the next slide, please. And we see the same kinds of claims. These are just a bit more detailed. That, it's often a kind of contest set up between AI and medical professionals. in this case, AI is going to beat the pathologists. It goes faster to detect COVID. It outperforms it. It's all of these sorts of things. We get a lot of these sorts of claims, and the most infamous, though I'm not quite sure what recent events mean, is that Geoffrey Hinton in 2016 claimed that, really we should just stop training radiologists because of AI. We would no longer need any radiologists. He was awarded the Nobel Prize in Physics a week or so ago. Possibly not a Nobel Prize in future prediction. Could I have the next slide, please? So this is a wonderful Dutch name. This man was the Minister of Finance when he claimed this back in 2020. He's now a European Commissioner, Wopke Hoekstra. And again, he's sort of saying, well, we don't know exactly how it's going to develop, but it's going to dramatically change everything. So again, and then he goes on to be specific about the work of the radiologist. It's going to become obsolete because, again, the pictures are going to, do better than the human. So again, you see, the same kinds of claims that we've been seeing about digital technologies for decades now, extremely deterministic. But it hasn't always worked out this way. We're going to have the next slide. So here we have a few more recent things where, some people are beginning to talk about a sort of crisis of credibility for AI. That those promises of 3, 4, 5 years ago, people, it hasn't quite delivered in quite the same way as people had hoped. IBM, which I don't know, 7, 8 years ago, there was much excitement about IBM Watson Health. They've now kind of chopped it up and sold little bits of it here and there. Many of the tools to help catch COVID didn't really work. That we have, I imagine we'll be talking about this later, that the issues around bias, whether it's sort of racial bias or gender bias, and these can be really matters of life and death, quite literally, when it comes to AI in healthcare. So what my next slide and my last slide is just a sort of reminder of things that I think we need to, take more account of when thinking about the use of AI in healthcare. One is incredibly complicated. I mean, this is a typical, what my computer science friends sometimes say to me, that, those of us in the social sciences and humanities just go around making things more difficult and more complicated. But actually things are difficult and complicated. You can't just, build something and throw it over the wall into the hospital and hope it's going to be taken up. And particularly in medicine and healthcare, there are very, very complex regulatory and political issues. Another thing that I think is really important is, and I've been guilty of this myself in the last few minutes, is that AI can be many, many, many things, but yet we often talk about it in the singular. AI is going to do this or that. And I think one of the challenges we had in the project is that we also wanted to look at what patients thought about the use of AI in their diagnosis. It was actually very, very difficult to, what do we actually mean here? Because some things hospitals said, oh, well, you could have a look at this. I thought, well, actually, that's just a decision support system that's probably been around since 1995. But now we're calling it AI. So that's something to be very careful of. But many issues of uncertainty, risk, trust, and responsibility, which are kind of merging together here. Enormous economic and environmental costs. Also, and something this might come up later, is we're introducing a major new player into healthcare. And of course, a lot depends where you are located. Healthcare in the United States is very different than healthcare in most European countries. But the kind of regulatory environment, the role of big tech companies now in the provision of important elements of healthcare is also something that needs, I think, more attention. And then what is often forgotten when talking about the use of any kind of technology in healthcare And I noticed this a lot when we were doing the work on people finding information, is that sometimes people are really, really ill and expecting them to make informed decisions about complex matters is sometimes asking a lot. So, what does it mean when we're introducing very complex advanced technologies into the healthcare system, when you have a lot of vulnerable people? When we were trying to think about this as well for our project, we found that many radiologists and pathologists didn't particularly understand how AI worked in their domain. So how we would expect patients to understand this was also kind of a challenging, how we would expect primary health people to explain this to patients. It's also rather challenging. So I think there's lots and lots to, even though there are, I think, many positive things we can do with AI and other digital technologies in the provision of healthcare, I do think there are many issues we need to consider. And I've probably gone over time, but thank you.
That's perfectly fine. Thank you so much, Sally. And it was really important to start actually with this issue that really affects all of us. So each person on this earth, planet Earth, of course, cares about their health and health of their loved ones and their communities and so on. So AI is definitely something that impact of AI in that sphere is definitely something that will have huge impact on all of us. And thank you for your really nuanced, actually, even though short introduction into all this, and we will have a chance to talk more about some of the questions that you raised. So thank you for that. Next, we will hear from Daniel Erasmus, who will talk about another very important issue today. So he will share his thoughts on the role of artificial intelligence in addressing climate change. Daniel, the floor is yours.
Thank you so much. And thank you, Sally, for a very nuanced and wonderfully critical speech about AI. I've been hanging with a lot of these sort of AI pundits, and just refreshing to hear you speak about these things. I think it's often technology is so overstated and so ungrounded in human practice and the complexity of it, particularly when people complain about the complexity of the space, when actually that's what we're trying to address. Just as a very brief background, we were asked to give a talk a couple of years ago on the promise and perils of AI. It was just at the start of these things, and I found the speech or the kind of broad circumstances of it very much sort of the broad social perils of it, and the technology overstating, etc., etc. But I think the real risk of our age is climate change, not AI. And of course there are many risks and many things, but clearly we are beyond a 1.5 degree world, and by a good margin already. And we need to prepare our worlds for a very different future. And so we thought we were in a unique position, and I'll show some things now, but we're in a unique position to address these challenges and using some of the capabilities of AI to augment our intelligence, to augment decision making, and support a transition at the scale of $100 to $300 trillion that we're going to have to allocate differently. So a little bit earlier decisions, a little bit smarter decision could make significant differences. And you have to allow me, I'm in the driver's seat here. So, and I'm, so the first, large way of intervention is sorry, you should be able to see my screen here. Is it just showing Firefox, or is it showing the screen itself?
We see the screen that says human-centered understanding of extreme weather. Yes,
and I would like to share the screens. There we go. I don't want application windows. My apologies. This worked wonderfully in
No worries.
Okay, I'll go from here. So
You can see it now.
The first thing is, it's artificial intelligence isn't interesting. What we're looking at is a social intelligence project, climate social intelligence. So how can we use this incredible power of this technology really to change the structure of the debate and support the structure of debate with a little bit better knowledge and showing the interconnections which people would have otherwise missed at the scale of the planet rapidly. And the task of our age can be thought of as there's a delta of the climate changing. And can we get our social systems, our social, economic, political, technological systems to be able to change faster than what the climate is changing? Obviously, there's structural things built in, so we're going to have to be a lot faster than that. But that really comes down to that's the challenge of our age. And so we wanted to apply, I'll show some things of it. The paper is opens there, it's openly published, the model is open source. We were tremendously heartened by both the partnership with the Club of Rome in developing this model, using the Earth for All work to support that, as well as the partners with which we established the first model, which was Equity Labs and Aptech. So we've had just fantastic support for this. And we built this on top of an extreme weather human-centered dashboard. So we tend to think of the climate very much as the weather, but we're in the Anthropocene now. And so what is happening is we're getting a significant shift here in the effects that this is having on us. And so showing those instances makes a tremendous difference. And I have to switch gears here. Sorry, I wanted to show the screen, which would have made it a lot easier. And I just want the whole screen share. Okay. And you should be able to, can you see the browser now? No. Okay. And so when one looks at this, one can suddenly start to see, go into Brazil, and you can see what the events are. We can see in September, there was a set of instances. This is open, publicly available. But more interesting enough is we can zoom in down to see at that village. So we process about 250 million URLs per day, and one can see down to those are the articles. And, AI models are, they're about 80 to 90% proper classification. So there will be some errors in this, as well as human classification, to be honest. But suddenly one can see this not at the level of sovereign. And what one sees is a massive underreporting of Global South and a massive underreporting of these events as they happen. And to give a sense of this, in Kenya, they were striving to get 15 million mosquito nets to address the flooding which happened in November there. So there's massive challenges that we're facing us. And then a chatbot underneath the extreme weather set is obviously Climate GPT, but also chatbot, so you can say, what are the breakthroughs in renewables? I'm just adding typos here, just as okay, change this. So we're just keeping it highly generic, and immediately one can see it's a multi-perspective view. Firstly, which we wanted to show here, so both social, economic, scientific, risk, and investment, and one can see a good starting point, plus references taken from just under 3 million sort of climate change in its broadest sense, facts there. So one can see where those ideas come from, and you can say, focus on systemic changes rather than technology. Cool. And immediately it starts to shift, because we tend to think of these things always as technical breakthroughs. There's some magical technology that will solve everything. And so one can discuss and carry on with these things. I know over time but it's there, it's freely available, it's open to everybody. And the intent is just not as an artificial intelligence project, but as a social intelligence project.
Thank you so much, Daniel, and thank you for this great presentation and introduction into Climate GPT. I'm sure we will have a chance to hear more about it and your work at Erasmus AI throughout this panel and in the future. Thank you for now. And we are now going to go from the Netherlands to Australia, and to hear from Deborah. Deborah, thank you so much for joining today and for staying late at night, your time, so that you can talk to us. Deborah will be talking about AI's impact on the social sciences. So Deborah, I'm looking forward to hearing from you.
Thank you, Juliana. Thank you for inviting me with this amazing people. I'm really, I enjoy a lot Sally's and Daniel's presentation, and I'm sure I will enjoy Charlotte. I will share the screen. Okay. First, as Emiliana said, I'm in Australia at the moment, in Melbourne. And so I want to acknowledge the Wurundjeri people, which is the traditional owners of the land I'm standing now, and also respect the past, the present, and the emerging leaders. And also I want to acknowledge all my colleagues from social science that are working hard to make sense of not only AI, but what's going on with our social worlds and the future of the planet. And I want to talk from my perspective, but I want to acknowledge all the other perspectives, because it's a lot of people working really hard. And sometimes, as Sally said, in our relationship with other science, we get into this kind of people problem, people in charge of them, talking for them, translating them, or even problematizing, bringing people to the life, which apparently is not there. I want, when Emiliana invited me to this talk, I was torn into two things that are happening around social science now. One is how AI or generative AI is impacting our own profession as researchers, and the topics and the problems we research, but also what is challenging when we look at AI about the role of social science in relation of the changes and transformations we are looking at. And I decided to go for the second one, how social science could engage differently with AI. And part of the idea to go to that side is what Sally present in her talk about this idea of emerging technologies hype, that we end up discussing what other science, other social actors, or other bodies like companies, governments propose us as the problem. So for this presentation, which I said preempting AI futures, because it's what I think we try to do in the place I work with, this Emerging Tech Lab in Monash University, is trying to understand the futures, the inclusive futures and communitarian futures and tech futures that could be intervened with, along with other actors. And I'm an anthropologist, so I will ground this talk in two projects I have been working in the last years, and also my what I did for the PhD, which is working in Internet of Things in Europe, and the merging of Internet of Things and the visions of futures with developers, understanding how they understood that technology and the role of that technology in the social world they were surrounded. And also I have been working in the last years in these two projects, one trying to understand how people work with AI, how they learn to work with platforms, particularly the end mile, people working for the platform, not developing the platforms, and also Autoware, which is a project to that is is still ongoing and is trying to understand ethnographically and with around the concept of future, how workers are working along with automation and AI in 3 sectors: construction, health, and sales. And I have been working in health here in Australia in a hospital, doing fieldwork with the nurses, doctors, and other clinicians in the everyday life, how they work with some automated features and artificial intelligence. And I bring in from this what I call ethnographic figurations, how people are actually dealing with these technologies and what are the expectations they have and what are like the promises they are bringing to their everyday life from all these other actors talking about AI. But particularly, I want to also, from this ethnographic background, from this project, and also my experience trying to engage with the topics as Miliana proposed us. And I was thinking to connect in certain way 4 things, which is the idea of risk, the tech world, people developing this technology, people like making the flow of money around this, and also people, policymakers and media producers around AI, and also the future of work, which is part of my, central in my work, and the global, the labor relationships around AI. Let's see if I can do this. But to connect all of that with social science, my point to propose is which will be the role of a social science that engage with all these factors at the same time, understanding that AI is more a constellation of things that a piece of technology is a process, ongoing process that has not only the systems, which what is a system, but also the notions, the configuration of this technology from the concepts and from the way people live with it. So if social science want to understand the risk for people and communities with this, should be working in unveiling what this technology actually is and what is going on, which is the difference of a narrative around a technology coming from the for example, this OpenAI or whatever, or other example, which is much more contemporary to, or for this week, which is the 101 ChatGPT, of the promises that they are bringing of this, as Sally said, like disrupting technology, and actually understanding what is the technology, what are the features and possibilities for this technology, and bringing things. And not engaging with the hype. So on one hand is critical thinking, but another is making new meaningful concepts with the people developing and with the communities that, for example, in the case of Sally, health or other communities having AI as something within them. And particularly, I will give the example in the future of war. Social scientists has been dealing with this topic and utopic idea of replacement, displacement, and reskilling and skilling. But the truth is, like, there is few actual research about what's going on with the AI in the traditional industries and in the emerging industries like platform, for example. And the research that is there, which is showing actually, is that people are not afraid of losing the job. What they are afraid of is not having the promise of the technology and or not catching up with what it's bringing. Another particular point in the future of war is like this has been, at least in social science, we have been responding to vernacular or vernacular and lexicon coming from an economy, and I'm not saying the economy is not a social science, what I'm saying is economy in terms of the relationship between the economy and the market, and what in science and technology is called the expectation of the market, the rules that make the technology happen in terms of an economic or a potential market. And in my view, social science has been following that lead, which is particularly inexistent when you go to the fieldwork and you understand how people are actually working with technology. So one of the things that social science, at least in the future of work, as example, could do is revisit the vernacular and lexicon that we are using, for example, skills, in the light of what is going in the world. And I will give you one stat, an example of that. In 2022, 28.9 million of people were working already with technology in or for platforms. Platform, I mean, from data brokers to delivery. And in 2022, 29 million of people in the European Union were working in the traditional industry. So it's almost the same quantity of people related to an algorithmic management of economic management that in traditional industry. In that context, for example, the concept of skills, replacement, and displacement don't make sense. Don't make sense. And the same with this idea of AI will come as isolated technology, which is, we know in social science, we have been working with this a lot, is not only deterministic, but also simplistic, because we know technologies don't work in isolation, and Charlotte could talk about this in the regulation, in the problems with regulating something, right? But the truth is, most of workers are already working in current conditions and contingent and on technological circumstances. That circumstances are changing on the light of AI, but that is not what will determine the future of the work. What will determine the future of work is that relation established with the subjectivities of workers, the access to the means of work, and also in terms, particularly in terms of AI, which kind of new geographies will appear? That will AI keep the ecosystem already happen, for example, in the United States, or it will be distributed and start new ecosystems in different countries that could emerge different labor markets? All the possibilities are things that I find much more interesting for social science to explore than the risk. And with this, I'm not saying that it's not important to take into account, and I hope we will discuss more this in the rest of the seminar, but I'm not saying it's not important to understand the algorithmic systems, how it affect people's lives, or bias or criticize the way that this has been coined with these other social actors, but also trying to understand what are the actual circumstances of people dealing with these technologies, from the development to the everyday life of people in different parts of the world. And the last thing, which I think is central, is start to rethink the vernacular visions of future of the AI. And again, because I have been working with techies, I want to be very specific with that. When I talk about AI, I'm talking about generative AI because we are talking about that hype. But AI is plenty of technologies around us that are embedded with from machine learning to code architectures and are like now entitled as AI. But I'm talking about this kind of media conceptualization of what AI is. This technology has the power to generate things as emulating humans. And in that sense, I want also to bring, and with this I will close, when I talk with the people designing technology for the hospital I'm doing fieldwork now, and also people that have been working in different projects in the past and now are working in AI, and I think that is people anthropology is working with AI. I know very well that. Like, I think Mina Rockenstein is on the audience. She is one of the biggest name in the research in AI. And we know that techies are not afraid of the same thing that the discourse about technology are trying to share what is afraid. And when we talk about them, what actually they are afraid of AI and why most of the developers of, for example, OpenAI or like Big Tree in China are leaving the companies, saying that they are afraid in the way that they are developing these technologies. They never said what AI could do, or this idea of the super intelligence that will change everything. They say there is no guide of what to do. We are not guided to anything. So we are going like blind, developing a technology that could be harmful when it's out. So that, and I want to close with this. That is an open door for social science. We will engage with people developing technology. We will engage with the governments deciding what could be or not. We will be prepared for the next technology, like let's say quantum computing, or we will engage again with the hype proposed by the market and other actors. My view is we need to engage with the actual process of designing this technology from development to media policy, and having a possibility of plan a future, a planetary future, not just deal with the consequences of others' actions. I hope I used 5 minutes because it's really late and I'm trying to make sense. So I hope I did on time. Thank you very much.
Thank you so much, Deborah. This was a really nice overview of how social scientists can engage with AI. And I know that you're doing some great work at the Emerging Technologies Lab at Monash. So I hope that we will have a chance to hear also more about some of your projects. And finally, we are now going to Charlotte, who, opposite to Deborah, who stayed really late to talk to us. Charlotte, on the other hand, got up really early in the morning. So Charlotte is calling in from Chicago. Charlotte, thank you so much for joining us. And Charlotte will talk to us about AI and law.
All right. Well, thank you so much for including me in this great group. I've really enjoyed the introduction so far, and I know we'll have a really wonderful discussion as we start to ask questions, both to each other and wonderful questions from you, Smiljana. So I'm going to just do kind of an introduction into some of the key categories in AI and the law and where we see a lot of recent interest. The first is one, because a lot of attorneys, we want to ensure our own existence. And this, I think, connects to some of the things that Deborah was saying, is about the practice of law. What effect is AI going to have in how we do our jobs? What is AI's effect on people who are new to the industry, to people who have been in the industry for a long period of time? And how do we engage in legal representation in a way that is fair for our clients, for people, to make sure that they are getting what they are expecting? So that's one kind of area. Another one is the use of artificial intelligence to automate legal processes. So examples would be in court actions, in regulatory processes. AI is being used today, at least in the United States, but I suspect elsewhere, to automate a lot of internal regulatory processes, to make things easier, to require less staffing, to make processes more efficient than perhaps they have been in the past. At least theoretically, that is the idea. And then the third category is the regulation and ramifications of AI in a variety of different industries and in government. And this is an area where I have the most interest. I spend a lot of time thinking about data protection, about medical device technologies, areas where individual people could potentially be harmed by their misuse or their non-responsible use. So I wanted to talk about some of the trade-offs and some of the relationships between different values we might have and what that impact might look like. So first of all, we have to determine, and I think Sally had mentioned this as well, an accurate way to identify risk of these systems. And I think that what we've seen from a legal perspective, and we've seen a lot of movement from the EU, which is fantastic, I think, in leading this discussion. But how do we figure out what the real risk is, not just the inherent risk, meaning that, you know, we have these systems that seem like they could be dangerous, but also how they're used in practice and what other types of risks, other than kind of what is obvious within that system, could occur if we think about these technologies on a more broad perspective. So across an industry, for example, across a population. And I think that it might be a little bit more nuanced than perhaps we've thought in the past, which is primarily around a safety perspective and primarily around a data protection perspective. The second concept related to kind of trade-offs and this idea is our connectedness and our need for data. You know, certainly I think most of us who have some familiarity with AI know that data is essential to the function of effective AI in many respects. We also know that getting that data, whether it is getting it off of the web, you know, scraping data, or if it's using kind of repurposing data that we've collected in the past, whether it's data exchanges, data sharing agreements, or collection from individual people, all of these carry with them new challenges. But the central kind of problem is that we need a lot of it. And so the question is, to what degree do we trade off how we currently think about different rights with respect to that data, whether those are contractual rights, whether those are individual rights? Are we willing to relax those standards in the name of potentially more responsible or safer AI? I don't know that we know that yet. I think that that's part of a lot of the new discussions we're going to be having. And then finally is the relationship between accuracy and impact. And certainly the environment is one of the areas where we're seeing this, of course, because to have really accurate AI, at least today, it means that you're going to use a tremendous amount of resources. So the question is, how accurate do we need to be and in what circumstances? And this also ties to the concept of data usage as well. How much data do we need to create effective training models? How much data do we need to tune those models? And then what kind of a setup do we actually need to create a product that's going to be accurate? And are the costs worth that investment? Certainly, as many of us have seen, a lot of the recent interest in artificial intelligence tends to be more related to things that I would describe as more, I would say, less essential and more fun. Now, that's okay, right? Everybody's entitled to have a little bit of fun. But the reality is, if we are prioritizing resource allocation to AI that are primarily for entertainment or for general consumption over essential services and other really important things that we might need AI for, we might have to make some decisions ultimately in what that might look like. Today, we're not really, I guess, confronted with a lot of those issues because AI feels new. And because at least in a lot of countries, it is still pretty underregulated. So a few kind of concepts that I think are worth teasing out. And I don't want to call these dichotomies exactly because they really are not exactly competing values, but we're going to have to figure out how to balance them. So the first one is, and I talked about this a little bit already, is the relationship of individual rights to collective interests. I think especially in the data protection realm, this is where we see some natural friction, which is when we are prioritizing the rights of an individual, ultimately that means that we can do less with data. There are more hindrances to using that data. There's more gatekeeping related to using that data. But if we tilt it in favor of the collective, that means that we're making decisions about a person's interests in that data, their autonomy. In the health sciences, of course, this is related to information about our biological characteristics, which can make us feel pretty uncomfortable if someone's using those without our knowledge or consent. Certainly, we have special categories of data that require a lot more to use them. But if our prioritization is on something like AI safety in areas that are really critical, that might mean that how we conceive of that data might have to shift in some way. We don't yet know what that will look like. We've already seen some interest in sort of the expansion of legitimate interest and what that can mean. But largely, a lot of the folks I talked to in the data protection realm, they're a little bit concerned about that because it feels like the loophole that swallows the whole, right? If everything is legitimate and we can't get the balance right, ultimately that might open the door to sort of untethered use of a lot of data that could be really important to people. The second area is related to how we regulate and sort of the balance of how we regulate. And this is the relationship between ex ante, sort of, before the fact regulation versus ex post recovery. What happens when things go wrong and everything in between. I think that the model that we have used, at least prioritized in most countries other than the United States, has been pushing resources ex ante, right? Getting ahead of the problem, trying to regulate before something is in the marketplace, before something is used. But ex post has a lot of really useful characteristics also, which is we can't always anticipate, especially with AI, which has a lot of foreseeability issues related to safety. Sometimes it behaves in ways that we don't expect. So we need a way to, whether it is collectively, whether it is by regulators, whether it's by individual people, the ability to recover when things go wrong. And at least what we're seeing in the United States is when you invest more in the ex ante perspective, we expect that there will be less ability to recover ex post, right? With the idea that if an organization has invested resources up front, they should not expect to have to invest a lot of resources later. But I think that this is an area where we need both. And ultimately, in a lot of countries where folks are not maybe exercising their rights ex post, there might need to be more interest in that space too, to really hold organizations accountable. And then the final one that I wanted to talk about, and I'll start to wrap here because I know we have a lot of conversations to be had, is the relationship between privacy and safety. I think that in relation to this idea of the individual and the collective is inherently this idea of what are people willing to give up to have products that ultimately are safer. And this dovetails, I think, with some of the things that Sally is talking about, where individuals are making decisions related to information that's important to them in the moment. So if you're in a healthcare situation, for example, your prioritization of what values are most important to you is probably going to be different than somebody's prioritization of values if they are thinking about buying a connected coffee maker, or espresso machine. Ultimately, it's just very different. It's highly contextual. And so how do we provide the appropriate information so somebody is able to make an informed decision in a way that makes sense to them in that moment? And ultimately, that might mean that it's not all about individual choice. Maybe in some cases, we have to protect people when they can't protect themselves. And this is something that I think, at least in the United States, is highly criticized, right? We want people to be able to make individual choices all of the time, but in many situations, they simply either can't get the information or are not in a position to understand the details of that information. And one of the biggest problems with artificial intelligence is that even if you provide the very best privacy notice, even if you have someone there discussing that privacy notice with them, even if you have somebody there who's discussing from an informed consent perspective what the potential issues could be, there is so much behind the scenes, both from a privacy perspective and a safety perspective and a sustainability perspective, that ultimately could complicate that decision-making process. And these are, and this occurs kind of all over the world. There are a lot of private contracts, a lot of private relationships related to infrastructure, related to how AI systems are built, related to how data are stored, how data are structured. the degree to which we have cybersecurity controls in place or not, how advanced those controls are, how exposed those connections are. All of that can affect the decision-making process. But how much time does a person have when they're making a critical decision about what to buy or what healthcare direction they want to take to understand all of those nuances? And ultimately, because the organizations that create AI often are many steps removed from the moment when somebody is making a decision about AI, it's very difficult, if not impossible, to get to that level of detail, even if somebody wanted to. So we really have to rethink what that decision-making process looks like and what the legal vehicles we use to motivate those decisions could look like. So I look forward to conversation with everybody. I think it'll be really energetic. Thank you.
Thank you so much, Charlotte. And this was a great introduction into that area that is very important for all of us and for the future of AI development and society and human security. So thank you to all the speakers, actually, for those really insightful contributions that all of you brought. I have a million questions. I hope that people in the audience do have questions as well for you. I wanted to give you a chance first to actually ask questions of each other. So does anyone on the panel have a question for another panelist? You absolutely have priority in that. So if there is anyone who has a question, yes, Sally, I see that you can. Please go.
Yeah, I'm not sure it's a question, but yeah, I mean, they were all great. Thank you so much to Daniel and Deborah and Charlotte. I mean, really, really interesting. I think they do speak to each other in interesting ways, and I don't think we're going to cover it all in the next 35 minutes, but okay. I mean, one of the things that struck me by what Charlotte said was also about data. And how important data are to the functioning of AI. And I kind of briefly mentioned that as well. And I think it came up in something Daniel said as well. There was some nice phrase Daniel had about human classifications. I'm kind of wondering what the non-human classifications are, but that's maybe a very side question. And I think, I mean, obviously data are really, really important. And one thing I didn't get a chance to kind of mention, I alluded to it, was the film that we've been making about the work of pathologists, was how much craft labor, and this is also relevant for Deborah, how much craft labor is needed to turn human tissue into something that's machine readable. And I think that's true for an awful lot of domains. I mean, obviously in healthcare and pathology, when you're taking cells or tumors or whatever, and you have to slice them up really tiny and put them in little things and preserve them with dyes and wax and all sorts of stuff. And seeing that process, it's a kind of wonderful reminder of the materiality, but that's and automating that, I think, is going to be really, really difficult. But actually what people then talk about by and large are the machine readable images that pathologists at some later stage are able to look at and maybe or maybe not share with one another. And this relates to the classification question, is that sometimes that gets really, really difficult because, literally one hospital is using one set of, even in the same countries, different hospitals use different classification systems. I mean, there's a wonderful article or chapter in Meredith Broussard's recent book called More Than a Glitch. I don't know if some of you have read that, in which she describes her own experience of having breast cancer and getting her hands on the data and share, she happened to, it was during COVID. I mean, it's a fascinating account. And finding that, breast cancer sort of algorithms, each model comes up with a different answer, and because they're using different data. And this is fantastically important when it comes to healthcare, but equally with all sorts of other kinds of systems, certainly when it comes to the climate crisis. But there's been an infamous case in the Netherlands of paying out of child benefits that went really, really badly wrong. So, data and classifications, topics I find utterly fascinating, but I was wondering if you could, maybe other examples from your own kind of work, share those.
Yeah, I think I'll just add that this is true across every sector. We've seen the problem in mass transportation, right? How do you get an effective representation of how, for example, all the trains function in New York City or across Europe as a way of considering autonomous trains or other modes of transportation? I mean, this is an area where there could be a lot of efficiencies, and it's not necessarily true from like a future work perspective that might be undesirable, but I think that also folks see a lot of promise in having these types of systems. But how would you even begin to design a system like that if you don't have adequate data? Yeah. You're sort of expecting that a lot of things will go wrong. And I think we don't always know a lot ultimately about what the systems are trained on and how they might be used. And I think that's highly problematic. There are a lot of AI systems that have been trained on data that is not even, so like in the healthcare area, I know systems that have not even been trained on health data. They've been used on completely other data types and then are sort of shoehorned to be used in healthcare. And this is happening everywhere. So we don't ultimately know a lot, unfortunately.
Can I add something about on what Charlotte is saying? Because I think she said something in the talk that I feel is central to understand any AI constellation. And it's like we still believe there is a kind of moment that we will arrive in with accurate, credible, and reliable information. And that will never happen. It always will be dependent not only in the data we introduce to train the systems or to apply or to make the system work, but also in how people design the technology. Nowadays, the object-oriented is even people coding AI didn't know what is inside of the architecture. So the abstraction is so big that if we don't move the idea of this idea of an eternal line that we will arrive on accuracy, then we are lost. And one of the things I read today, actually in the morning, is this O1 ChatGPT, which is not the ChatGPT 5, but is a new kind of relation with the connection with data that this entity can look for different answers and compare, because actually there's no one answer to any question. So that will never happen. Or if it happened, that when we need to rethink, but I think we need to move from this idea, if we talk about legislation or health or things that are central for our future, this idea of will be accuracy, will be credibility, because it will not happen. And I think Charlotte made that clear.
I think that one of the challenges here is in model building, so which I can speak with some degree of knowledge about, is the problem of gold standard data sets. You're training a model and you want to get some level of confidence in the data set that you're training the model on. And, just as a sort of a first humble proposal, and we shouldn't call it AI, we should call it large statistical machines. And wherever the word AI is mentioned, just change it with really large statistical machines. Now, there's a different debate, on our own consciousness here, and that's a separate debate. But for now, we have large statistical machines that at its cutting edge is more or less the same amount of weights as a house cat. That's what we have now. And as enamored as we are with this technology, and as wonderful it has its moments and it's critical, it's still barely a house cat and a lot less than a house cat if you just weigh the neurons versus, say, ChatGPT 4 plus those things. So it's not close to anything. But the challenge of large or sort of gold standard data sets. So in training Climate GPT, you kind of want to ground it with a particular set of responses. The first challenge is that the gold standard data sets, because it's so large that there's no human that can actually process that data set. You can have well-curated data sets, you can get a good overview of it, you can do statistical sampling of that, you can build visualization networks of that and understand how those things are. And those are sets of tasks that one goes through. But you know, having that, and so the challenges of classifying data. So there was my earlier point there, to go back to Sally's point, is that if you ask a human, an expert, to classify data, 83% is sort of what we can bear. And so that's one. Two is experts are weak predictors of the future. You know, time and time again, experts anticipating the future way underscore the general population, even chimpanzees throwing darts, you know. So not just are the data sets not really gold standard, we don't have overview of them, and they have multiple perspectives in them. The best, if you were to have thousands and millions of people working through them, only 80% of that data will be actually gold standard, and you won't know which 80% it actually is. And then lastly is that the capability of having anticipatory logic in the models, which is kind of what we want, because we don't want to reify the past. You want to have some level of anticipation in the models. Otherwise, it's, you know, there's a bunch of simple tasks which, God bless, AI should be doing, not humans. But those are incredibly challenging bits. And the bias inside these gold standard data sets, or supposed gold standard, is deep, it's unexamined, and it's fairly obtuse. So for us, the challenge was we relied on the gold standard, which was sort of the international development community. So what did the OECD write about climate? What did the IPCC write about climate? The Club of Rome's own work on that, which is quite critical about some of those things. The World Bank's work on that. The World Resources Institute, the International Renewable Energy Agency. So these things. But it really has a focus from the global north, looking at the global south, with a particular development view. There's not much written in Kenya on the challenges of climate policies, or in Sri Lanka, or in Ghana, or in this. And many of those global south countries have climate liabilities and have had none of the economic benefits of putting the CO2 in the air in the first place. And so it stayed as a challenge for us. And we said, okay, let's just get to accurate answers first, and grounded accurate answers first, and then start to work at the problem of broadening it. But it'll persist as a massive challenge within these systems, and largely unexamined or critically assumed, as long as we call it artificial intelligence instead of large statistical machines.
Thank you. Thank you all for this additional comments and explanations. Daniel, I will, use your term of large statistical machines, although of course it is not so catchy and so interesting like artificial intelligence, which sounds so promising and scary at the same time. But just to follow up on what pretty much all of you, I think, were saying, my question is, what do you see? And I see that we are already getting some questions from the audience, to which I will go after asking my questions. So what do you see as some of the good practices that we currently have for establishing and scrutinizing the credibility of those large statistical machines?
Just Warren, just to add something, sorry, I've just been now, but we started by saying, give a multiple perspective answer, and just different perspectives, just add a different perspectives. So users of these large statistical machines, commonly referred to as AI, though they can see that there are indeed very, very different machines. And it's not that the agents talk to each other in some long-founded, no. It's simply language prompts that you use to reveal topologies which are inherent in networks. That's how it works. There's no conversation going on. So showing multiple perspectives in user response brings a certain level of humility to that, brings the thing that most of the interesting questions you would deal with have multiple perspectives, and allows users some agency in opening up, because clearly any complex, whether it's the Large Hadron Collider or any serious complex machine that we have in our day and age, is, the phone here is fundamentally impossible to understand for its user base. That's the characteristic of our age. And we simply can't wish that away. The question is, what level of agencies would have people in this, and what are the broader social impact that these technologies have as they cascade through our social, political, economic systems? And they're largely unexamined in Silicon Valley.
Thank you. Sally, if we go back to your example about the breast cancer patient who gets different results from different systems, so what would be some possible ways in such cases about thinking, how do we determine and scrutinize credibility of those different machines and different results that we're getting?
And I'm perhaps a little less pessimistic than Daniel about, some of these things being fundamentally kind of important. And, I work in a university. I like to think education helps, that more and more education about, how these things actually work, helping people understand, some of the issues that we've been talking about, whether it's about the source of the data, how the models get trained, and all the rest of it, I think helps people deal with that. I think and this is something I observed in the very early work I did about health information. I think one of the big problems is that probability is a really difficult concept. And a lot of people have a lot of problems understanding probability, which is really fundamental, especially in a lot of the healthcare stuff. And the breast cancer case was a little bit different because it was the genetic testing is all about probability. You may get this disease at some point in the future with 37% chance or whatever. But, in this case, you either have a, binary thing based on, the examination of the tissue eventually. I mean, but in the mammography, it was a different process to kind of say, well, do we need to do any kind of examination of the tissue? But sort of related to breast cancer, but not entirely. I mean, my favorite example of the good use of big data, if you like, in healthcare comes from Denmark, where they have very detailed population data. Okay, it's a relatively small country, most of the time reasonably social democratic country. And, they do have population data. And when somebody or some anti-abortion / pro-life group in the United States tried to claim that having an abortion was highly, a good predictor of developing cancer later in life, which is not true for anybody listening. But, these kinds of claims are made in certain political climates at the moment. And the Danes got together and looked at their population data and said, this is just not true. We've got the data on who's had an abortion, who's not, who's developed what forms of cancer, and there is really no correlation here, people. Now, that doesn't mean you're going to convince the people who made the claim in the first place, but I thought it was a good use of, with all of the kind of caveats and problems of population data and classification and the rest of it, as to how we kind of regulate. And I mean, I do, on my less optimistic moments, I do sometimes get worried about the massive multiplication of ethical codes for AI. There's an awful lot of them out there. I mean, I think I need a kind of large statistical machine to kind of interpret them. But so, I mean, I have faith on a good day in education. I also have faith in the state rule of law. So the lawyers need to get on with it as well.
Yeah, I guess that we all have some of those, more pessimistic and more optimistic days when it comes to large statistical machines. You see, Daniel, we now all adopted your term. There is one question from the audience related to data, so I will read that one. It says, for data, should the publishing industry be able to claim new IP rights, prevent large statistical machines from reading? Anyone? I don't know whether members of the audience are able to participate to have audio presence, or we can only read, but would anyone like to take on this question related to data and publishing industry and IP rights?
So I am not an expert in copyright, but I will at least say that I do think this is a huge issue. I think that a lot of, especially the large language models that are geared towards consumer use, are engaged in broad web scraping. And in fact, it takes a tremendous amount of resources to do that. So we should be, aware of that. Even contacting these websites at the frequency that often they are automatically contacted takes resources from those websites too. So I think that what we're likely to see, at least what I'm hearing will actually happen, is that a lot of these entities will be pursuing sort of technical solutions to prevent this from happening. I think that there have been a fair amount of suits where there's interest in claiming additional copyright rights or reinforcing copyrights, sort of pushing back against, at least in the United States, what we call fair use, but either sort of reasonable use and kind of a small scale that has been generally appropriate in a lot of legal regimes for the use of otherwise copywritten information. I think, though, that we can't necessarily, at least I don't foresee us dramatically changing the law. I think it is more likely that we'll see the rise of technical solutions that are not that different from those of us who remember Napster and LimeWire and all of the kind of music issues in the early 2000s. What emerged from that were a lot of technical solutions, right? The uploading of music, dummy music that would frustrate people, anti-circumvention technologies. I think that we'll see a lot of that before we'll see a lot of dramatic legal changes, at least in my view. I don't know if others have something to share on that.
I just on the data sets, I think that there is, clearly there's some space here for discussion. One can also see a global dimension to it. So the view in Japan and Singapore is markedly different from the view in Europe or parts of Europe and then the US. So and I think the challenge of web scrape data and certainly models, because if one looks forward here, and I'm just not advocating any position one way or the other, we're simply trying to focus on climate. But for most of the developing world, by the hundreds of millions of people, these AI things will become their teacher. That is the reality of it. That it presents an educational opportunity for hundreds of millions of people. In the same way as social media became their friend, in the same way of these things. That is the world we're in. That's clearly what's going to happen. And so the question is this the best of our knowledge? Is this the best of our thinking there? And web scrape data ain't it. Not close. And so we have tremendous knowledge in published works with great depth and knowledge and et cetera, but there's a classic case where you'd ask a large chat model and how many people live on Mars, and it will confidently say 2 billion. And because it's read a science fiction book where there's a future where there's 2 billion and there's large statistical machines wouldn't know the difference. And so, obviously this has been treated and this has been taken out as people work at these classes of problems. But the question here is, we have an educational opportunity for hundreds of millions of people, if not billions of people, in an entirely different and challenging future leading ahead. And how do we get the best tools in their hands? And that may not be commercial tools, that probably is open tools, that probably is trained on different sets of data, but that is the future we're going in.
Yeah, can I comment something about that? Because I feel like this is one of the risks of not of AI, of us with AI, which is like just perpetuating certain relations, geopolitics. Why if there is any developing world, why they will be is an opportunity for them, and what will happen with the non-developed, the already developed world, or the Western world. Because my feeling, I was in Europe until 2 years ago when I moved to Australia for 12 years. I'm from South America. I'm living in different countries, working in different countries, studying in different countries. What I've seen in the last 10 years, 2 years ago, 10 years back, is like a divide between people that are actually getting an education in institutions or are with a system of education, and people that are accessing to other kind of education that are considered like secondary universities or things like that. And this divide in who will be accessing to the top 10 universities and who will be studying in universities are like just not as considered as the other ones. It's a tendency I have seen more in the Western world than in the what's called the developing world. What I've seen, at least in Latin America, which is the region I come from, is and particularly with AI, it's not that they are using an AI; they are trying to get an economic and kind of economical relationship with AI, trying to or selling their own capacity of creativity or consuming what could help them to create an ability to make money. So this is less related with the advance of any kind of knowledge that eventually can end up in a better life. But actually, and I think I'm coming back to something that Sally and Charlotte said, which I think is really important to consider, is like the contingents of the moment, when people take decisions, how people consume, relate, and what people will green light with any technology is completely related to the constellation they are in life, in there. So any prediction on what AI will impact the developing country, I think we should be really careful to think that, because actually we don't know. We have no idea, except that we believe that the geopolitics will continue like they are, a center just developing technology for others to consume. That probably could happen, but I want to believe that things will change at a certain point, at least with technology.
And those are some of the really excellent points. It's not only that that AI is not one technology, but a set of technologies. It is also what AI means in different parts of the world and in different contexts of use. I don't know whether we will have the time today to talk about so-called invisible labor and data workers who are, for example, at this moment working in Lebanon or in Syria and so on, and practices about big platforms in appointing those workers and work conditions in labor conditions in their working. So maybe we'll have the time to talk about that. But I would like to go now to one of the questions from the audience, and it is interesting that Daniel was talking about books that would tell you that there are 2 million people living on Mars, because the question for you, Daniel, is exactly related to that. So the question is, are articles considered by Climate GPT peer-reviewed? How far is this a criteria for inclusion, as it could underline the importance of a stronger weight of human creative judgment?
So the articles which we reference at the bottom, it's called retrieval augmented generation, which isn't very important. But when one looks at an article and then you find sort of a vector of what that article is about, and you see if that matches the response, and you can influence a model's responses based upon those articles. So it is close to a reference, but it isn't quite the same as we would use references. As we would understand references, certainly in our terms, there. And so we have focused there not just on peer-reviewed articles, but also if the OECD writes something. And these are broader public intention research reports there. So they're not peer-reviewed in that sense, but they're developed by the United Nations, by, in this case, in the Club of Rome. They're reports for the Club of Rome in the partnership. So there's various of those tasks. And so they're a bit broader than just the peer-reviewed section, but we certainly weighted towards, because our job is to try to get, and it doesn't always work, but the closest, most factual answers with multiple perspectives on them, to bring our actions just a little bit further. The difference in our yearly spend on reaching, net zero and then actual zero and then taking the carbon out of the air is, Early action is probably around $1 trillion per year, and delayed action is around $5+ trillion per year. So early action matters massively to global health, and as well as sensible action matters. So we just try to ground those responses within the best knowledge that we have. And maybe one other note here, which I was starting to mention, is that our model was trained on green power. It's the first foundational family of models that had a sustainability scorecard in the paper when it was launched. So it's quite viable to build these models on green power. It was a non-trivial exercise to achieve that. And inference today, openly, publicly available, and it still runs on green power. And so, and the big part of the team that built it is in Africa. So not just, these are, seen as impossible hurdles but they're actually quite viable if one puts effort into it. And I'm not saying many of the bigger players aren't concerned about that, but it is quite viable to achieve these things with green power. Yeah.
Thank you, Daniel. We have only 5 minutes left. I would encourage members of the audience, if you have any last-minute questions, please do post them in the chat or in the questions and answers section. And until we get the next question, one question that I have, and that's something that pretty much all of the panelists were talking about, starting from Sally's points on whether we need radiologists at all, and to Charlotte's points about lawyers need to ensure that they are not being replaced, although there are some assessments that actually law professionals might be the first or among the first to be replaced by AI. My question is, when you think about the future of work, what kind of professional reskilling do you see will really be necessary, and what kind of professional reskilling would be useful actually to have? The question is for all the panelists.
So maybe I can just say one thing very quickly, and then I'm certain that Deborah will have a lot to say on this, so I want to reserve time for Deborah. I think that we have to be cautious, and the reason I say this is because we're dealing with a connected electronic system. So something that we've actually seen, and this is not related to AI, but is related to cyber attacks and ransomware attacks, is that we've had medical professionals, for example, who can't use their medical devices because the medical devices at the hospital are all internet connected to the network. And many of them have forgotten how to use analog machines. And they've had to dig things out of closets in some cases, ultimately to do it. So one just caution, I think, is this concept of trained incapacity, that we get to a point where we have, reduced the amount of people who can do the work, and the people who are still doing the work now no longer know how to use an alternative. I think that's very scary in a lot of fields, not specific to law, though, because it's kind of different for us, but for a lot of essential workers in particular.
Thank you. Anyone else who would like to comment on the future of work and questions about reskilling? Sally?
Yeah, I mean, your example, Charlotte, reminded my university was hacked about 5 years ago, and on the 24th of December, and it was all hands on deck to get everything ready for when the students came back in early January. And it turned out, and that everything was connected to everything else, including the beamers in classrooms. You couldn't use them because they were all connected to the network. I thought, why in God's name are the beamers connected? And, I helpfully said, well, do we still have any overhead projectors anywhere? And, my colleagues under 40 wouldn't know how to use an overhead projector. They'd get everything upside down and back to front. And there was one somewhere, but anyway, but I completely agree that kind of, we do need to remember how to do things in case it all goes really, really badly wrong, either very locally or kind of on a more global level. And I think that's especially true for medical professionals. I know, the student doctors at my university sometimes complain about why they're being taught to use a stethoscope. And you say, well, you might need it one day, which seems kind of pretty basic. But I think the other thing I would want to add to all of this, and I sort of hinted at it earlier, is I think, you know, we do live in an incredibly technological society and world that whether you're a brain surgeon or a lawyer or anything else, understanding your increasingly large statistically based machines and tools of your work is really, really important, I think. Also to understand the possibilities, but also the limits of the tools that you're working with. So I think whatever the kind of domain, we all need to kind of try and get to speed, or at least some understanding of what the kind of possibilities and risks are of these things.
I completely agree with Charlotte and Sally. And I feel like the main point of this, and I don't want to introduce this as kind of like new threats, but actually most of people I mean, the thing is, if quantum computing actually happened in the level that this conversation will be completely out of time. So it's not, I feel like thinking about skilling or reskilling, I feel like I try to make the point in the conversation is having a really provincial view in terms of it is needed, like we need to talk about it, it's not, but I think we need to understand the context of it's not catching up with the new technology, it's not catching up with emerging technology. And I don't want to use this, but we need like a literacy in technology, and we need to understand the transformation in situ, in the industry, in the context. And one of the things that I learned in the project Platform, which is this project how platform workers learn to work digitally, learn to work with algorithms, is learning is a process that never happened in abstract, always happened in the working context for construction, for health, for law, for everybody, for the social science, for so understanding the process of learning and how learning to work and understanding how technology is related and constitute that work in the job, in the practice, and giving it tools to think with, to work with, to relate to technology in practice and in the career, in preparing to be professional, whatever professional means. I think it's much more important to think which kind of particular skills they need now or need for, because we will be always chasing something that will never exist. And really, if quantum computing happened, so I hope somebody will remember how to, at least the health professionals, and otherwise we will be all of us in church asking God to wherever. Yeah. And it's not science fiction.
Thank you, Deborah, so much. We have one more question for Charlotte, and I will just read it because we are unfortunately out of time. So I will just read the question: how can ethical issues be included in regulations concerning AI? So definitely one of the very important questions. I also, as I said, have a bunch of questions. So this only means that we need one more session to continue our conversation. But unfortunately, we are out of time for today. I wanted to thank all of you for your time and for your really great, insightful contributions to this discussion that is very important. Thank you for the World Academy of Arts and Science for hosting us and for giving us an opportunity to talk about this. Thank you, Nebusha, for organizing this. And I wish a beautiful rest of the day or evening to all of you. And I hope that you will continue the discussion about all of these important questions. Thank you all.
Thanks very much for the invitation.
Thank you and goodbye.
Nice to meet you all.
Bye-bye.
Bye-bye.
Bye.
Bye.
Thank you all.
Thank you. And thank you all in the audience, of course.